I'm Alana Smith. There are many different organs in the body, including the heart, the liver, and the lungs. The heart, as we know, delivers blood throughout the body, the lungs pump oxygen, and the liver filters the blood. There's another organ, however, that many of you may not know about, and that is the pancreas. To know the pancreas more in depth, it will be nice to know where it's located, how it functions, and what can go wrong with it. The shape and the location of the pancreas are very important. The pancreas is a grayish-pink organ about 6 inches long, and it is the shape of a fish. It is on the head is on the right side of the body, and it hooks to the duodenum, which is the first part of the small intestine. The left part of the pancreas is the tail end, and that is the narrow end. There are 5 parts of the pancreas, which are the body, the head, the tail, the neck, and the nunciate, said Medicine Net. Located in the back of the abdomen behind the stomach, the pancreas is very important because the functions of it rely greatly on the location. The functions, however, are not normally known by people. The first function that the pancreas does is it makes endocrine enzymes, which are insulin and glucose. These are then secreted into the bloodstream and together regulate glucagon. Insulin, however, on its own, regulates the amount of sugar in the blood. Now, how do they get where they need to be? First, they flow to the tail of the pancreas, where that hooks up with the main pancreatic duct. There, it goes to the duodenum, where it mixes with other food and breaks down fats, proteins, and lipids. This was all said by Dr. James Norman on Endocrine Web. The other function of the pancreas is to produce digestive enzymes. Somatostatin is one of them, and it inhibits secretions of insulin and glucose. Gastrin, which aids in the digestion in the stomach, is also production of acid cells in the stomach, and this is also aided by that. Now, the University of Virginia Health System said that there can be many different things wrong with the pancreas. One is pancreatitis. Pancreatitis is the autodigestion of the pancreas when enzymes attack the pancreas. This can make the pancreas become inflamed, and this can also kill tissue cells. Pancreatitis can come on acutely or chronically, and when it comes on chronically, which means it is reoccurring, it can damage the pancreas, leading to scarring. The causes of pancreatitis are gallstones that get lodged in the main pancreatic ducts or alcohol abuse. Other less known causes are abdominal trauma, surgery, kidney failure, cystic fibrosis, or tumors. The symptoms of pancreatitis are severe upper abdominal pain. Other symptoms are nausea, vomiting, rapid pulse rate, fever, mild jaundice, swelling of the upper abdomen, and dropping blood pressure. The diagnosis of pancreatitis, however, is normally with blood tests. This can tell if the enzymes are elevated and that the pancreas is inflamed. Also, abdominal x-rays, ultrasounds, ERCPs, CAT scans, and EKGs can also be done. The treatment, however, is not such an easy decision. This depends on your age, your overall health, medical history, your tolerance of certain medications, and the extent of the disease. Normally, the treatment is to rest the pancreas, which involves hospitalization with IV fluids. Other treatments could be surgery, antibiotics, avoiding alcohol, pain management, and bed rest. Chronic pancreatitis, however, is treated differently. You may receive insulin, high-protein meals, enzyme supplements, or medications to decrease gastric acid production in the stomach. Another problem, said Virginia Health, is pancreatic cancer, which is the 4th leading death. Pancreatic cancer is when cells grow too much. Now, if you're over age 60, you smoke, have diabetes, family history of pancreatic cancer, chronic pancreatitis, are a man or an African American, your chances of pancreatic cancer are higher, but this still does not mean you're going to have it. There are several types of pancreatic cancer. The most common, which involves the lining of the main pancreatic duct, is adenocarcinoma. More rare types of pancreatic cancer are cystadenocarcinoma and acinar cell carcinoma. There are other rare, non-cancerous tumors that can grow on the pancreas. These include insulinoma, gastrinoma, and glucagonoma. The symptoms of pancreatic cancer are pain in the upper abdomen or upper back, loss of appetite or weight, jaundice, indigestion, nausea, and upset stomach. The diagnosis, however, is fairly simple. An ultrasound, a CT scan, an MRI, an ERCP, a PTC, or a biopsy of the pancreas can also lead to the diagnosis of pancreatic cancer. The treatment, however, is very complex. This, again, depends on your age, your health, your medical history, the extent of the disease, the type of cancer you have, and your certain tolerance of procedures or therapies. The treatment, however, could be from surgery, external radiation, chemotherapy, or radiation. The third problem with the pancreas is pseudocysts of the pancreas. This can be related to pancreatitis. It is also a collection of fluids, dead tissues, or blood causing a painful mass in the abdomen. The symptoms of this are abdominal pain, nausea, vomiting, poor appetite, weight loss, diarrhea, and fever. The diagnosis, along with a thorough exam, a chest x-ray, a CAT scan, ultrasound, or an ERCP, may be ordered. The treatment of pseudocysts of the pancreas depend on, once again, your age, your health, medical history, extent of the disease, and your tolerance to certain medications, procedures, or therapies. Now, the treatment is to monitor it, and if it gets bigger, to remove it. They monitor it by scanning, but if you have cysts, you may need to have those removed surgically. Cysts can rupture, causing pain, blood loss, or infection. The pancreas, as you have now heard, is very important. It digests food, it regulates sugar levels and glucogens, and without one of these, your body would not be able to function. The three problems, pancreatic cancer, pancreatitis, and pseudocysts of the pancreas, are three very common and very serious illnesses. They are treatable, but not always curable. I personally have pancreatitis, and doctors cannot figure out how to cure me. I have also searched for answers and have come up empty-handed. All these three illnesses are very debilitating, and I soon hope that doctors or someone will find answers to them.